Is forgetfulness the only sign or symptom of dementia? Is memory loss the only early indication that the person has dementia? Well, the short answer to the longer answer is no. There are many different signs or symptoms of dementia. Every person is individualized. When you've met one person living with dementia, you've met that one person living with dementia. There are other signs or symptoms that we don't even consider when it comes to diagnosing someone with a particular type of dementia. Some of these signs are things that we encounter or experience every day, but don't even consider it as it relates to someone having dementia. So I'm going to identify at least 3 of those most common signs, some of those most common behaviors that we see or may even experience, but don't even look at in terms of identifying it as an early sign or a symptom of dementia. You're going to be surprised. Hi there, everybody. I'm Dr. Macie Smith, the social gerontologist providing education, training, and caregiver coaching to help you and your families reach the next level of care. This video today is sponsored by Joy for All Pets. So before we get into the content, let's hear from our sponsor. So when we think about signs and symptoms of dementia, and even early signs and symptoms of dementia, we typically think about forgetfulness and memory loss. While those are signs of dementia, they're not the only sign of dementia. There are other symptoms that we need to pay close attention to when it comes to our older adult loved ones in terms of their behaviors. Let's take memory loss, for example. Our seniors do a very good job of hiding what they can't remember because of some of the outcomes that could evolve as a result of a senior not remembering things such as out-of-home placement. But because they can hide things so well, you don't even realize that they don't remember. Take, for example, your name. They may choose not to call you by your name. They may choose to call you honey, baby, sweetheart, sugar, but never call you by your name. But they used to call you by your name. So you don't even consider that a thing or a sign or symptom because you're saying, "Aw, she has some sweet pet names for me," without even realizing this is something new for them. So that language changes. Their wording changes. If my mama ever called me baby, sugar, honey pump, chocolate pop, I know something is wrong. Now, she loves me dearly, but she never called me those names. She always called me by the name that she and my dad gave me. So to me, knowing what I know about the disease process, if she starts to use other names besides what she's accustomed to using or using other words besides the words she's accustomed to using, that's going to be an indication that something may be happening. It may not be dementia, but it could be a sign of something going on cognitively. So pay attention to their language and the words they choose to use. If they're starting to use more curse words, if they're using mean words or words that don't make sense, words you can't even look up in the dictionary, that may be an indication that they can't remember the words that they want to use. So pay attention to language. Then there's eating habits. If they begin to eat too much or they don't eat enough and that's different for them, it could be an indication that something is not connecting between the brain and their stomach. They're not getting the signal from their brain to their stomach that they're full or that they're hungry. So the part of the brain that manages control and resistance, it may be impacted by whatever is causing dementia-like symptoms. So pay attention to their diet and their eating habits. If it changes and it's different for them, something may be happening. It may not be dementia, but it's an indication that something cognitively is concerning. Then there's personality changes. If they have extreme highs and extreme lows and their mood is erratic, or there's no trigger for the anger, or there's no trigger for the sadness, that may be an indication that something's happening, because there's a part of the brain that manages emotions and how one feels and how one responds when they're feeling a certain way. So there may be a blockage there. So you want to pay attention to their mood, and if the mood is shifting without any apparent triggers, then something may be cause for concern. And then there's judgment. Making proper judgment as it relates to that person. Now, if that person has always been an individual who did not make good decisions, then you may not be able to use this as a gauge. But if now they are not taking their financial stability as a means of importance, and they're spending erratically or spending uncontrollably, and that's different for them, something may be happening. If they are getting a mailer in the mail and there's a key attached to the mailer, and that mailer says, if you send us $2,000 or $200 or even $20, you win a brand new car, and they send the money in, that may be an indication that something is going on with their perception and their judgment. There's a part of the brain that manages rationalizing and making sense of things. That could be an indication that they may be dealing with some form of dementia or other conditions that could affect their cognitive capacity. So while memory loss and forgetfulness are absolutely signs and symptoms of dementia, there are other signs and symptoms and behaviors you should be mindful of. For more videos like this, be sure to like, comment, and subscribe to my channel. And don't forget to click the bell so that you know when I upload a new video. Until next time.